Hi everyone, I'm Dr. Rodríguez-Feliz, board certified plastic surgeon here in Coral Gables, Florida. Earlier today, I posted something in my social media where I mentioned that I was operating in the hospital, and I received a lot of questions from patients. Doctor, don't you always operate in the hospital? So I felt it was a good time to clarify different settings where patients actually can have surgery, in particular for cosmetic patients. So I would say about 99% of the cosmetic plastic surgeon or plastic surgeons would perform their surgery, or would prefer to perform their surgeries in an office-based surgery center. What does that mean? So that means is a fully accredited operating room where general anesthesia can be provided, where board certified anesthesiologists can be available to provide anesthesia. But the actual setup is located either within or adjacent to the surgeon's office. It actually has to be connected through at least a door, and it's usually a separate suite, but it's adjacent to the same office of the surgeon. This is the preferred method for myself and for most plastic surgeons because it's a lot more efficient, it's a lot more cost effective for the patients. The risk for infections is lower, the risk for DVTs is lower. Now, what happens in this particular setups? Only patients that are ASA 1 or ASA 2, meaning patients that have either no medical conditions or patients that have mild medical condition that it's under control, they can have surgery in that type of setting. But unfortunately, plastic surgery patients are not always like that. Although obviously the first thing is to make sure that the patient is completely stable before making a decision like, yes, I can operate on this particular patient. But for example, in my case today, this lady had a completely stable medical condition, but she had a history of a heart attack, and she actually had stents that were placed. So although at the moment she's completely stable, because of the magnitude of her past history, I elected to do her surgery in a hospital setting. Now in the hospital setting, we count with the same type of thing. We have board certified anesthesiologists, we have a fully accredited operating room. Now, in the event of any major event, then other specialties are located in the hospital. So it's a lot more, peace of mind, I would say, for the patient and for myself. Now, the one area that I feel something is a little bit gray and patients don't really understand well is that in-between area that is called an ambulatory surgery center, where a lot of surgeons also operate. An ambulatory surgery center, it is not, although many times it's adjacent to the hospital, or many hospitals have ambulatory surgery centers, it is considered an independent center or unit, meaning the patients are meant to be operated there and discharged home. In reality, when you compare ambulatory surgery center and office-based surgery center, the same kind of people can be done in both centers. So the preference for surgeon is to either use an ambulatory or office-based surgery. And for those patients that have a medical condition, then those are brought into the hospital. And this is why it's extremely important that your surgeon has privileges in another hospital and a hospital facility. There's a lot of plastic surgeons that do not count with the requirements to have privileges in hospitals, and because of this, many times some patients that are, their medical condition, it's delicate, they might be actually kind of, either forced or be operated in the incorrect setting, either office or ambulatory, where that patient should have actually been done in a hospital. And you really do not want to take the risk from a safety standpoint. So make sure that your surgeon or the plastic surgeon you're going to choose have privileges at a hospital facility, because in this way they'll be able to decide what's the perfect setting for a cosmetic surgery patient to have surgery. I think this is very important for you all to understand, so I figure I'd take some minutes or a few minutes to just clarify to the best of my knowledge.